Office of Statewide Health Planning and Development, the Automated Licensing Information and Report Tracking System, also known as ALIRTS. My name is Cindy Thompson, an analyst in the Accounting and Reporting Systems section under the ALIRTS team. I'm going to give you a short tutorial of the ALIRTS system. ALIRTS is a web-based portal that all medical facilities that are licensed through the state of California are required under Section 1216 and 127285 of the California Health and Safety Code. They are required to submit an annual utilization report. All hospitals, long-term care, primary care, and specialty clinics are required to submit by February 15th. Home health agencies and hospices are required to submit their reports by March 15th. Today I'm going to instruct you as to where to find the ALIRTS website, as well as find the forms and instructions to help you create your reports in ALIRTS. I'm also going to navigate you around the site as to how to use the search and the advanced search feature. You will also have access to viewing license information. Finally, I will navigate you into how to find your facility's reports and how to create a new report. Once that report is created, I will also demonstrate how to submit that report. Okay, as you can see, our website is http://alerts.oshpd.ca.gov, and also our forms and instructions are at http://hid/forms/alerts/forms/user-guides.html. There are several ways that you can search for a facility. When you are searching for a specific facility, it can be identified in ALIRTS in two ways: by the facility's name or by the facility's OSHPD 9-digit number. Each facility type is identified by the first 3 digits of that 9-digit number. 106 are for hospitals, 206 are for long-term care facilities, 306 are for primary care specialty clinics, and 406 are for home health agencies and hospices. Please note, you do not need to be logged in to view a license or view a report. However, you do need to be logged into the website to be able to create or revise a report. To use the general search function, let's take a peek at the ALIRTS website. We are going to go to the ALIRTS homepage. It gives us all the pertinent information that we need. When we are looking for a facility, there is a white box over to the right of the screen, and right next to it is search. In order to find that facility, you can either put their name or the 9-digit facility number. At this time, I'm going to use the name, and I'm going to put East Valley, and I'm going to click search. We can filter that, and we can say East Valley Hospital. And we'll click search. There we are, East Valley Hospital. It's on our ALIRTS Licensed Facility Search Result page. This page tells us a lot of pertinent data. It tells us that the license number for this facility. It shows us the facility name, East Valley Hospital Medical Center. It also turns us as to where it's located at. It also shows us the OSHPD ID number, the type of facility it is, a general acute care hospital, and also, most importantly, the actions. What this means is you can either view the license or you can view the reports. There is another way to search. Please look over onto the left-hand side in the gray area, and you will see it says Advanced Search. I'm going to go ahead and click, and it's going to open up to a new page, and this is the Advanced Search Home. There are 4 search categories: the facility name, the facility number, the facility license, the legal entity, or we can search by the district, congressional district, Senate district. Please be aware that you cannot use the 4 separate entities together, meaning you could put the facility name of East Valley Hospital and then put in the license number. These are separate entities, and as such, they need to be used separately. So we're going to go ahead and search for the East Valley Hospital by the facility name. And we're going to put East Valley Hospital. And we're also going to put the license category it is in. And it is a hospital. And it's a general acute care hospital. So we're going to go ahead and click. It's going to populate the box. And we're going to go ahead and click search. And it shows up. Here we are, the East Valley Hospital. Now please notice on the right-hand side, under the word black in action, you can click View License or View Reports. There is a lot of different information when you view your license. When you view your license detail, it has all the information that is on the license for that facility, such as the license number, place of doing business as, how many beds, total licensed beds the facility has, what type of bed they have, intensive care, coronary care, also what types of services this facility has, emergency, respiratory care, and the different outpatient services. When we click on East Valley Hospital, it also gives us a lot more information. And as you can see, we also tells us that what kind of census, what assembly district, what Senate district they are in, whether it's a teaching hospital, where their mailing address is, and any other pertinent information is all on this webpage. Again, you do not need to be logged in order to see this. The only thing you need to be logged in is for you to edit or to submit your report. Let's go back to our home page. And we're going to go and search for our regular East Valley Hospital. However, we're going to use our OSHPD ID number, which is 106. I'm over here in my white box, in my search box, 106-190-328. And I'm going to go ahead and click search. Again, it came up, East Valley Hospital, all my pertinent information I need. Now I'm going to go ahead and click under the word black in action. I'm going to click View Reports. On this page, this is the Utilization Report search page. It gives us pertinent information as to all of the years that we have turned in a report. It also shows in the middle of the box the report year, a drop-down arrow, and a new report. And as you can notice, this facility does not have the 2013 report viewing as of yet. So in order to create a new report, we're going to go ahead and click our little drop-down arrow. The previous years are going to highlight as I take my cursor down to 2013. 2013 is going to highlight. I'm going to click. It's going to highlight in blue, and I'm going to go ahead and create my new report. A new web page has just been created, and this is my 2013 report for my hospital. However, just because I created it does not mean that I saved it. I'm going to take my cursor over to the right-hand side, and I'm going to scroll all the way down to the very bottom. At the very bottom of the report, under errors and warnings, there's a little box that says Save. I'm going to go ahead and I'm going to click that box, and when I do, it's going to refresh and it's going to give me back to the top of the page. At this time, I need to go back down to the very bottom. So I'm going to take my cursor and I'm going to scroll all the way back down to the bottom. And this time, I'm going to go ahead and close. When I click Close, a text box is going to come up and it's going to say Warning. Closing the report will not save any changes. No worries. I'm going to go ahead and click OK because I have not submitted any information that needs to be saved. So I say OK. When I do, a brand new web page comes back and we're just made like a big old circle and we're back to our utilization report search page. However, there's one difference is I've created my 2013 report. And as you can see, I've got my 2013 report. It's in process. And now I can view it or I can revise it. Please notice that the 2012 report just above is I can view or I can revise. However, I cannot revise the 2011 report. In ALIRTS, it only lets you revise for 2 years. So since I created the 2013 report, I am not going to be able to do anything with the information in 2011 or below. However, if I need to change some data in 2012, I will still be allowed to do that. So now that I have created my 2013 report, I am ready to enter all the information that I need to in order to submit my 2013 report. And how I do that is I just go ahead and I click Revise, and I'm back into my report. I enter all my information, and then I scroll down to the bottom as I'm entering my information, and then I click Submit, and then a text box will open up and say Certification. However, that's for another day, and we're going to go ahead and we're going to close this report. And again, my little warning came up because I didn't put any information. That concludes how we create a report. Our general search and our advanced search are major contributors in how to navigate into the ALIRT system. We have showed you all the wonderful functions that the advanced search has to offer and how you can find a facility just using it. I've also showed you how to obtain a facility's license, how to search for the facility using the OSHPD ID or facility name. I showed you all the wonderful information that the ALIRTS licensed facility search page results can give you, such as the license, the facility name, all the information as to where they're doing business as, their OSHPD ID number, and how that word in black action can be a huge help in either viewing the facility's license or viewing the facility's report. I also showed you how to create a new report for submission, how we need to go through the steps, be sure that we save at the very end. We need to validate our report and then save and click Close. I have showed you all these wonderful functions that ALIRTS has to offer. If you have any questions, all you have to do is call 916-326-3854. And a staff person will help you in any and all questions that you may have. Thank you.